Hi, I'm Minister Joannides, and this is the Optimum Academy Diabetes 101, video number 4. And we're going to talk about complications of diabetes today. So, elevated blood glucose is pro-inflammatory, so it causes inflammation in the body in all the vital systems of the body. So, it can be a real nuisance and damage a lot of important structures that we require in the body for good health. So diabetic complications raise the mortality risk and underwriting ratings. So unless the blood sugar is controlled, all sorts of downstream complications may occur. The better the glucose control, hopefully the fewer the complications. So effective continuing health care and monitoring by diabetes experts can help prevent many diabetic complications. So complications of diabetes include the heart and blood vessels, so cardiovascular disease, the kidneys, nephropathy, that's what we call it, diabetic nephropathy, eye disease called diabetic retinopathy, and diabetic nerve disease called diabetic neuropathy. And diabetes can also affect the immune system, and people are at risk of infection or inflammatory diseases. So let's talk about the cardiovascular system. So someone with diabetes can have coronary artery disease, it could have a heart attack, and it may be a silent heart attack. In other words, the heart attack may not be accompanied by the typical chest pain that someone may have with a heart attack. But when we look at the EKG, there may be evidence on the EKG that the person had a heart attack. It may contribute to stroke risk as well as heart failure. So high blood pressure and lipids need to be ideally controlled as well in order to reduce the risk. So if somebody has a combination of high blood pressure and diabetes, obviously you want to control both problems. The SGLT2 inhibitors, like Farxiga, and the GLP-1 drugs, glucagon-like peptide 1 drugs, can add cardiovascular protection in addition to treating an elevated A1C. So these two drugs, or classes of drugs, may be ideal in somebody who has diabetes and cardiovascular risk factors. So I mentioned a silent MI in diabetes, so a heart attack without the typical chest pain. So to the left is a normal EKG. And if you watched our cardiovascular or heart videos, Heart 101, I did talk about EKGs. This is another example of a normal EKG to the left. And I've circled in blue what we call leads 2 and 3 are the inferior leads along with AVF. So I've circled those 3 leads. And you'll notice in the normal EKG, there is no evidence of a Q wave in those leads. So that would be considered normal. To the right is what happens in leads 2, 3, and AVF after a MI, an inferior myocardial infarction. You can see with the little arrow in each of those 3 leads that there is a deep Q wave. So that would be evidence that this person likely had a prior heart attack, even if they weren't aware of it. And this can happen, as I said, in diabetes, and we would consider if they never really knew about it or didn't have the typical pain that they had a silent MI. And of course, we still would want to rate or do whatever we needed to in underwriting to have this case considered at a higher risk due to the combination of diabetes and a prior heart attack. Let's talk about the kidneys. So diabetes can contribute to chronic kidney disease, CKD, and when the kidneys are affected in a negative way by diabetes, we call it a diabetic nephropathy. So if the creatinine is elevated, if there's protein in the urine or any evidence of kidney failure, that would be something that we would be concerned about and rate the case more highly if they have diabetes. So we check for protein and albumin in the urine and elevated creatinines in the blood. Diabetes is one of the major risk factors for people with kidney failure and end-stage renal disease that require dialysis. So that's why controlling complications from diabetes is so important. The eye and nerve complications in the eye, we call it diabetic retinopathy, because that's the retina that's affected. So people with diabetes need routine eye checkups in order to keep an eye on that. And you can see in the picture to the far upper right the comparison of a normal retina with all those areas that look abnormal in the diabetic retinopathy picture to the far right, with it looks like flares of light colors, and then the red patches of basically bleeding into the retinal areas. Under diabetic neuropathy, that's when the nerves are affected by diabetes. There may be motor nerve or sensory nerve damage. So in other words, it may affect the function of your body in a certain way, or it just may be reflected in abnormal sensation due to nerve damage. And it can also cause what we call autonomic neuropathy, and it can affect things like the gastric propulsion and dealing with food in the GI tract. So autonomic neuropathy is also a possible complication of diabetes. So when underwriting diabetes, the risk of type 1 is greater than the risk of type 2. We look at the other factors when we're doing an underwriting assessment of someone who has diabetes. What's their build, high blood pressure, lipids, and other possible risk factors. We look at any complications they've had along the line, because that would raise mortality risk and raise underwriting ratings. And of course, any combination of all those problems with smoking tobacco would certainly be even more unfavorable. So that completes our diabetes videos. Thanks for joining us at the Optimum Academy.